Hi, I'm Chris Seibert. I am a North Carolina Certified Peer Support Specialist and Harm Reduction Specialist for Sunrise Community for Recovery and Wellness. I work in the Harm Reduction Program at the Buncombe County Health and Human Services Building at 40 Cox. Down here, we do quite a bit of things. First off, what most people recognize harm reduction for is safe use supply. Providing people with what they need to use substances that they choose to safely, reducing disease transmission, and keeping people safe. We also hand out test strips, make sure people understand and have the autonomy to understand what they're using. We hand out basic wound care, do some hygiene, do plenty of Narcan distribution. We also do Narcan trainings out in the community with different local resources, organizations, institutions. We have a Hep C bridge counselor, helping people get connected with Hep C treatment, working in the prisons as well as the harm reduction program. We can work with peers on accessing transportation, different communication needs, sometimes getting into treatment or housing. Then, say the most that we get to do down here, my favorite part is just the support of connecting with individuals that come into the harm reduction program. We see a lot of people in very vulnerable states, and we get the chance to connect with them and share our own lived experience and kind of show them and be a beacon and a lighthouse of like the way to finding some recovery and wellness for them, whatever that may look like. People that access our program are 4 times more likely to pursue treatment and access things like detoxes and treatment centers. We also manage the syringe disposals around town. We have currently 7 located throughout downtown Asheville and some surrounding neighborhoods. We manage these and take the returns, dispose of them appropriately. We have roughly over the past quarter about a 50% return rate, which means half of what is going out we are actually able to return here and dispose of appropriately. Our return rate is significantly above the national average, if not one of the highest. This helps keep syringes off the streets. This is how we engage with our people. It's great being able to go out and actually take care of these boxes and see our peers there and be able to talk with them, because when they see us out in the community, it is just adds another level of trust and connection. Gives us the opportunity to do a lot of outreach also, connecting with our peers outside and of our space and closer to theirs. So we also work with the University of North Carolina, Chapel Hill Gilling School of Public Health to test substances that we see locally for anything that may be happening in the chemical landscape, which we have witnessed to be changing consistently. So the better informed we are, the better support we can provide as far as wound care, as far as understanding, the dangers of detoxing from these things. Helps us better support and take care of our people and their health. You come into a community and you see people and you hear stories and they learn to trust us. These are individuals that have faced significant barriers in healthcare, in community, in accessing any basic needs. And when they see our faces consistently showing up, 4 days a week to do the work and meet with them and hear them and ask the questions and, tell them, treat them with dignity. They learn to trust us, and they learn that, there's somebody I can turn to that will help me navigate whatever it is that they're trying to navigate. Some people just come in and say, I'm having a hard time with a friend, and we're there for that. And sometimes people come in and say, I'm having a hard time going to the hospital and I have a serious wound, and we're there for that too. Being able to support people through whatever, keeping the doors open. That trust builds over time, and they show up as long as we show up.